I'm Amanda.
Welcome.
I'm Amanda
Thank you.
Hoprich.
And I'm Beck Moore, CEO at CAP. And with us today, we have a special guest, Aaron Lucas, CEO at Bucks County Opportunity Council. Hello, Aaron. Thank you for joining us.
Hello, and thank you for having me.
Well, we appreciate you taking the time, and we are excited for today's episode as we're changing up a little bit of our format. So, Erin is our first, we'll call her volunteer, maybe voluntold a little bit, but Erin is one of our wonderful board members who supports us in everything we do, and we appreciate her so much. And this is one of our first program deep dives. So, we're excited to kick off the episode, and we're going to talk a little bit about the innovation in community action programming, what Erin has accomplished in her organization at Bucks County Opportunity Council, and provide some context with how Pennsylvania is always shaking and moving in the community action world. I'm going to give a plug in some of the things if you haven't tuned in to episode 3, celebrating 60 years of community action with Denise Harlow. Make sure you check that out, where we talk a little bit about the innovation in community action programming. And when we thought about this episode, really BCOC rises to the top of our list in all the ways that you're addressing social determinants of health and all the ways that you have really, innovative programming.
We're really happy to have you today, Aaron. I think, when I first started here at CAP, you and I had a lot of conversations. I had the great opportunity to come to a couple of events locally, and just have always from day one been really impressed with all of the things that you're doing at BCOC and right. We use a lot of acronyms. Bucks County Opportunity Council, also known as BCOC, if you're not familiar. And so I think if you want to start by just sharing a little bit about some of the framework of your programs and how you all look at community action at BCOC. Why don't we start there, and then we'll dig into some of the more deeper sides of things.
Oh, okay. So you want to talk about all our programs?
Well, I think just right, like there's a framework to how you all approach this work, and I think that's an important starting point. And then we want to talk about some of your specific programming, but I think an overall framework for how you really look at the community work that you all do. I think it's an important perspective that we want to make sure to share. And we touched on this a little bit with Denise, but I think, hearing from you specifically will be helpful.
Sure. Um, well, I think first of all, it starts with our mission. So our mission is to reduce poverty and partner with the community to promote economic self-sufficiency. Very simple, very straightforward. We are looking to create opportunities and programming that help people become as self-sufficient, independent, have the economic mobility that they need to live a quality life. That's kind of our guiding force of how we determine what programs and services we're going to offer at BCOC. Obviously, as part of community action, we do a needs assessment every 3 years, and we really use that needs assessment to determine what are the big gaps in services in our community, and is it something that the Opportunity Council can help with the resources that we have, or do we need to go after some new resources to help plug those gaps? We kind of have 5 program areas that we operate under. We are the lead food agency for the county, so we get the state and federal food dollars, but we also get a lot of local support from retailers, people such as Wegmans, Giant, some other large Amazon Fresh, some other large food entities in our county, and then a lot of private support from local farmers and other suppliers, I'll say food suppliers in our community. And so we move about 3.5 million pounds of food each year into the hands of people that need it. Our goal is always to keep people fed, but it's beyond that. It's to get people fresh and nutritious food that they can't often buy on limited income, limited or fixed income. So that's our food program. We also are a large participant player in housing in our community. We offer really a variety of programs under that housing umbrella, from homeless services, street outreach, homeless services, all the way through to helping people in our economic self-sufficiency program buy their first home. So um, we do eviction prevention, emergency services, utility help, lots of different things, all under that umbrella of housing services to help people stay housed, find stable housing, or become a homeowner. I mean, there's lots of different things
Yeah,
under housing
absolutely.
services. We also are a weatherization organization, so we provide home energy conservation throughout Bucks County. We work with a lot of local contractors to provide that service, and the whole goal for us for that program is, again, keeping people housed, having people be able to stay in their home because through weatherization, the home becomes more affordable and safer. So weatherization. And then we also do the free income tax preparation program called FIDA, Volunteer Income Tax Assistance Program. We do about 14 to 1,500 free tax returns a year with about a team of 50 volunteers. We see that as an economic mobility program, as it puts about $2.5 million back into our local economy each year in fees saved, returns, and credits that people get back. And then the last program, kind of our cornerstone program, is our economic self-sufficiency program, where we really partner one-on-one with a family to help them move towards self-sufficiency with the help of education and employment. We really just help people. We put the supports in place to help people achieve their goals. That's the easy nutshell way of saying what self-sufficiency work is.
Yeah, absolutely. Thank you for that overview. I know that it's a lot to all talk about, but I really appreciate that overview because I think it helps people understand just how robust many of our agencies are, including yourself, and the ways and the layers in which you're able to help people through all of those services is really incredible. And so let's rewind a little bit to the Fresh Connect program. I want to start there, and then hopefully, if we have time, we'll get to a couple other things. So help us understand, how that program, the structure of that program. I know we've spent some time talking about this in, you know, how people are getting connected, how you're able to serve people, and all of those deep relationships locally to really make all of the mechanics of this work together. It's a very complex logistical side of work that I don't think people really can appreciate completely unless you've seen it happen or you've been a part of it.
True. Fresh Connect is a mobile produce market that we deliver fresh produce out to the community 4 times a week. So we're in 4 different locations every single week, same spot, same day, same time, delivering fresh produce and lots of dairy items as well to the community. So people walk up model, they can come choose what they want. It's a number of volunteers that help to provide that service in the community. But really, how Fresh Connect got started was we knew we had a problem. We knew that we had lots of food pantries who were giving lots of non-perishable food items out. And we had people who were saying, I would provide fresh produce to my family. I would cook, fresh foods, eggs, and other things, but I can't afford to buy them. And if I can afford to buy them, it's in a smaller quantity and not enough to make an impact in their family's health. And so, with the help of multiple partners, and honestly, it was not BCOC on our own, it was multiple people, all part of our local Hunger Nutrition Coalition, who decided to come together and create this mobile market. Let's go out to where people are instead of making them figure out what times and availability a certain food pantry has, which we still do, and we still promote that, and we put a lot of fresh produce out into the pantry network as well. But we really wanted to get out into the community for 2 things. One, we wanted to be able to provide that fresh food, but we also wanted to create the sense of community. So people coming together, gathering, I know that it probably doesn't sound great. They're in kind of line together as that is choice. They want to come. And we didn't understand it at first when people wanted to come and get in line. We were like, just come anytime during these 2 hours and produce, it will always be there for you. We will never run out. But people were like, no, no. I talked to somebody last week and I want to see if they're here and I wanted to connect with them. And so over the last 6, 7 years that we've been doing that program, there have been little families kind of that have developed, and people don't come all the time. They don't come every week. They might come once a month. They might come, every couple of months, but they see the people that they know. They see our volunteers and our staff members, and all of our partner organizations together. And so our health partners as well. I mean, all the people together are delivering this service to the community, and the community feels loved. Like they feel that they're
Seen.
seen. Yeah,
Right, right. They're seen, they're a part of the community,
yeah,
right? Yeah,
absolutely.
I love that story. I was just on a health equity call not too long ago, and there was a story about food delivery, and then there was a fresh food market that was created for seniors, and the seniors get picked up and taken to this fresh food market, and they love their time at the fresh food market. And there was a question posed about should we bring the food back to the seniors? And the overwhelming response from the seniors was no, like we want to go, we want to spend time together, right? And I think
Wow.
there's that sense of community. It's part of what I think one of the beautiful things about community action, right? We are in everything we do, we are a convener of people, right?
Yep.
We are a connector of people. And I think this partnership, the methodology, and then, the unintended outcome is the sense of community you've created among the clients then that are being served. And I think that's really beautiful. I think that's really amazing.
Yeah. I mean, honestly, it's been one of the highlights of my time at BCOC. As I think that for me and for all of the partners involved, we know that it is having a tremendous impact on people health-wise, community-wise, connection, and honestly, just people who, like you said, they feel loved, they feel nourished. People are saying they've written us notes to say, I got my recipe books out again. I can cook. I could do it, but I didn't have the resources before. And
Yeah.
we've gotten the pantries to be involved and some of our other partners to be involved to make sure that when we're collecting donations from the public, we're not getting, just the extra cans that are in somebody's pantry, but we're being really intentional and asking people, if you're going to donate, could you donate spices? Because people won't buy spices, but who doesn't cook with spices of some kind?
Right.
But like these are the top 5, 10 different spices that people need, and people love that. I
Well,
think,
and cooking a meal together, right? Like
yes,
there's a cultural component of that in homes. It creates a sense of family in a way that it creates dignity for people.
it does. And I also think for the people who are donating,
Yeah.
there's there's a purpose to it. I am getting things. Here's some things I know I would like. Let me get them for them as well, and make sure that children, if mom wants to cook lasagna, that there's garlic and there's salt and there's, it's not just noodles and sauce, but there's some little love, little spicy love that goes into that stuff. So I think that that's been very cool. The one thing I absolutely love about Fresh Connect is that we have some nutrition partners that offer a recipe. So one of our partners, Rolling Harvest Food Rescue, they are an organization, grassroots organization that goes out and gleans and grows actually at this point, but they glean lots of fresh vegetables and fruit from all of our local farmers, and they also grow some at a couple of specific farms. They have some farmers that are invested and are like, yep, I want to grow specifically for you guys. But they bring recipes to Fresh Connect and not only share the recipes, but they make the food and bring it and give out samples to people so that people that didn't ever see an acorn squash before or know what to do with it, they're like, look, we've made this salad or we've made this soup. And people love that. And they love telling us, like showing pictures and sharing pictures with us of, look what I made, look what we did. We've had people write to us and tell us that they've lost weight, their blood pressure has gone down, they're
What?
just overall healthier.
Well, and they're
And it's
bringing
a cool thing.
accessibility
Yeah,
to that, sometimes mountain to climb. They're,
yeah,
here, taste it. It's,
Yeah.
we're constantly doing that in our house. We have a rule that not only, to the adults, but it started with the children, but we have to try something new every day
yeah.
because sometimes it's intimidating if it's something you've never made before. And
That's right.
bringing the recipes, I mean, gives the accessibility, which when we talk
Mhm.
about social determinants of health, one of the biggest barriers is access.
Right.
So that's amazing.
I
Well, I
think
want
the
to.
nutritionists also try to make sure that they're cooking with ingredients that are easily accessible. So not only, okay, here's this squash, but here's a couple of things that you probably have on hand at home that we can make this recipe. They're not making exotic, intricate recipes. So that's also been a very cool thing.
Well, so I want to go back to what you just shared there, Amanda, and something that you mentioned, Aaron, as well about the health piece. And you talked a little bit about your health partners. And one of the things, if you know, shameless plug, if you go back to one of our prior episodes with Karin Van Zant, episode 2, we talked about social determinants of health. Want to kind of pause here for just a second, in that we know that from a health equity perspective in the state of Pennsylvania in particular, we have a large propensity for diabetes and we have other health issues that when we eat a lot of processed foods, canned foods, boxed foods, right? We're not including fresh foods in our diet. We have poorer health outcomes. And so how have your health partners reacted to or have, you know, a little bit about kind of the things that you're tracking potentially or some of the data that you're seeing? And you touched on this a little bit, but anything in particular that you really want to call out in terms of what your health partners have really gotten excited about in this space?
Well, our largest health partner is Trinity Health System, or here it's St. Mary Medical Center in Bucks County. And so I think Trinity is or an early adopter. They are a part of the inaugural program and got started with us right from the get-go. I think for them, you know, they're looking at through their community health needs assessment, they are tracking all of that data and looking at that information. We do surveys of people who come to Fresh Connect a few times a year. And the data that you know has come back, it's hard to say because some of that is anecdotal. It's, you know,
Sure.
self-report and
Absolutely.
what the families are saying are telling us. But people have told us that, you know, their blood pressure has gone down, they have lost weight. There's been people who have said their diabetes is under control, you know, because they're getting 20 to 30 pounds of fresh produce every week and cooking more often for themselves. And so I think the health partners are just excited about that piece of it, that one, the resources available. And so they have a direct referral. Like, I know where you can get fresh produce every week, same place, same time, and that they have a solid place to send people to. And then on the back end, I think that they are looking at more of the health data on, you know, individual levels for people,
Sure.
how it's affecting them overall. You know, it's great when I visit Fresh Connect on any given day, you know, if it's apples that are being given out and seeing like kids walking out, like eating the apples, right, fresh from, you know, from our bins. You know, I just think it's very, for all of the health partners that have been involved or are still involved with us, I think that it's knowing that people have access, and that if a person is given a directive or like a script to eat a certain way, that it's possible.
Yeah.
Whereas, you know, that it might not always have been possible in the past.
Yeah.
And while, I mean, I think the other piece is that Fresh Connect is a resource and it is something that we are very passionate about and make sure that everybody knows about it. But we are also really diligent about getting fresh produce and product to the pantries as well.
Yep.
So that if someone can't come to Fresh Connect during the day, that they still can get produce. Like, we have partnered with other health entities and other foundations to make sure all our pantries have refrigeration, which wasn't always the case, but now they have refrigerators and freezers, so that they can accept fresh produce and meat and dairy and be able to get that out to people. So you know, I like that as well.
Well, and the other thing I want to touch on two more things, and then Amanda, I know we're going to get to our big question that we always make sure to ask at the end. We're creeping up here, I know, to close to our time, but I want to make sure to kind of point to two things that you all have done, having toured your facilities and seen some of the things in action. when I think about coming to visit, there was something that you all had done to put together snacks for people, right? So that they had an opportunity for something that was nutritious, something that was also, edible and good tasting as well. Can you talk a little bit about that initiative and why it really matters and some of the pieces that you put in place to do that?
Sure. I think what you're talking about is at our Help Center, which is the Healthy Eating and Living Partnership. That is a collaboration with our local United Way. We work in partnership with them. We are the food resource, and they do in-kind goods for household needs. Um, on the food side, when we first opened up, we opened up in April of 2020 quickly because we knew right then and there we needed this space. And so we opened up quickly. But what we started to see was that people, we're in a shopping center in the lower Bucks region where we have a higher population of people who are homeless, and also very low income. And we purposely chose that place because it's a food desert. There wasn't a grocery store anywhere around. But what we started to see were people that were coming into us looking for food. And if you know, we started off as just a food distribution point. We were not serving individuals,
Yep.
but because of the need, together with the United Way, we said we need to pop up an emergency food pantry here. We need to have an emergency food resource here. And so what we started with, um, we crafted these and put together these bags that had pop tops, that had nutritious food like chicken, canned chicken, um, peanut butter, crackers, fruits, granola bars, protein bars, things that, and even water and juice, things that people could easily take with them. They would feel like they were, fed. There were beef sticks, different things like that. They were fed, and it was, dignified, and it was immediate. Like we could get you something today while we work on, like, what are we doing next for you? And so I think that was one of our, it was just built, we built it because there was a need. And because when people started coming in and we didn't have food to give, we gave them food, but we probably didn't give them the food that was best for them. And then we surveyed them and asked them, what do you want? Like, what should be in these bags? And that's why we created the bags that we have. People
And
come.
you're meeting them where they're at. Just
Hmm?
like with Fresh Connect, you're meeting
Yeah,
them where they're
meeting
at.
people where they're at and trying to provide um, immediate easy access to food while we work on the bigger issue, which is homelessness.
Well, the reason I wanted to touch on that example is because I think it goes back to what we've already said, right? The intentionality, the thoughtfulness, evaluating the needs, even just understanding where the local, a food desert is, and recognizing this is where this really needs to be because of this. So it goes
Right.
back to the accessibility point, and I just think really speaks to understanding community actions ability, BCOC, Bucks County Opportunity Council's ability to really see deep need and try to address it in a timely, appropriate, dignified, accessible manner. I mean, that's
Mhm.
really what it comes down to in the end.
Yeah, I mean, it's honestly why the transportation program also popped up. It was just a big need in our community, and we knew that at the time, no one else was really filling the gap.
Yeah. So before we get to the question that Amanda asks all of our guests, is I want to just touch briefly on the Lyft program that you all run, and just if you can share a little bit about that, because I also think it's a pretty incredible, thoughtful approach to what you've been able to create and really help people.
Sure. So through a community needs assessment, we recognized that there was a big gap in transportation for people who just needed short-term assistance until they had the first paycheck or the second paycheck, or getting to and from medical appointments, people who didn't qualify for medical transport, a lot of different things. There's some health inequity that we created a later program that, I could talk about at another time. But the LIFT program, we started with a CSBG discretionary grant. I wrote the proposal and said, this is just a big need in our community and we want to try it. And CSBG discretionary gave us the opportunity to try it. It was so successful. We just formed a Lyft concierge, or like a Lyft business partnership. with the Lyft ride company. We became the business concierge and just hired someone to do transportation for us. So their job is to um, field the referrals from different case managers at our organization and now some outside organizations as well, and get a person from point A to point B and back home again. We can do that daily. We could do that weekly, monthly. It really just depends on what the person's needs are and what the coach or case manager has worked out with the person. Could be until their car gets fixed. It could be until we figure out what is available in public transportation, all those different things. But it started with a small grant from CSBG discretionary, and now we have been running it for 3 years. We have other funding from other entities that has kept it going, and it's been really powerful. I have other organizations that have reached out to me across our county and across the state, some across the country, to ask like how do you do this? And Lyft's not for everybody. You have to figure out what works for your community. But where I live in Bucks County, the Philadelphia region, Lyft is
Provided.
everywhere,
Right.
and it works really well for us.
So the one thing I want to say, and then Amanda, I'll be quiet and let you ask your question, is, I think to that end, the community services block grant funds that Community Action has available allows for the flexibility to be able to try these types of things, address deep need. And I think in what you just touched on there, I want to highlight is that, there are plenty of scenarios that many of us are the one emergency away from being back in a situation that we came out of and or finding ourselves right having to be reliant on services. This is a good example, just like so many of your other programs, right, that allows for a temporary assistance for somebody so that they don't have to be reliant back on a welfare system, right?
Yep.
It allows that temporary relief. And I think that's a really important underscoring of part of what you all do so well in so many different places of your programs.
Well, thank
I'm
you.
going to quote you, Erin, in one of the things that I think always stays with me is you can't just throw money at it.
Well, that's true. That is very, very true. You can't just throw money at a problem. You really have to have kind of a comprehensive knowledge of what is needed, and work with community partners to address those issues. I don't think that money is always the answer. Money helps, that's true,
Fair.
but it's not always the end all be all. You have to be thoughtful in the approach. You have to have people with lived experience at the table so that you're not just creating a response to something based on what you think they need. They have to tell you what is necessary, and that's Lyft came out of that. People told us like if I could just have 2 weeks while I work on figuring out how I'm going to get that car repaired, I won't lose my job. And that was all I really needed to hear. I'm like, yeah, we're gonna do that. Like there's no problem. We're gonna figure that out. And uh, I was thankful to our state DCED office for having the ability for us to apply for those grants and those discretionary grants, because that helped us be innovative and get off the ground. And once I proved that it works, I found other funders.
Yeah. Yeah. It gave you capacity to build other opportunity. Yeah.
Yeah.
I
Shout
love
out Department of Economic Community Development. Our folks at DCD, we love you.
Yeah.
All right, Amanda, ask your big question and then we'll wrap up.
My big question, Erin, if you don't know what's coming already, is what myths are you busting about community action in Bucks County?
Oh, I did not know that was coming. What myths am I
And
busting?
it could just be myths are you busting in general, or what do you feel like, right, you're lifting up about community action on the regular, what people don't know? Because, we talk about this regularly, not on
Wow.
necessarily just on the podcast, but we also talk about this, outside of the podcast and our regular day-to-day conversations. We have a little bit of a branding issue. People don't know about who we
Yeah.
are. And so what are the things that people are surprised to hear? What's the myth that you're busting?
Well, probably the biggest myth is that we are a business. We are a sophisticated organization who is thoughtful in our approach to how We are addressing community needs. We are huge data geeks, collect a lot of data, and
Truth.
use it for future planning purposes. I mean, we use it so that we can develop the next innovation or interventions. And yeah, I think that people don't always acknowledge that. It really irks me when people think that you're a
You
nonprofit.
just work for a nonprofit.
Yeah, you're a nonprofit, you're not a business, or we could help you, and businesses absolutely can help us. They can help us through volunteering. They can help us through financial support. They can help us by promoting our programs and promoting the work to their employees and, because there maybe people, there's always somebody in your organization that could use help. So I think that was my myth busting, is that we are a
I
business
love that myth
and that
busting.
we are data driven, and we care, really, we do. We care about the whole community, and um, we'll try to figure out, if we can't do it, we're going to figure out who the partner is that can.
Love that. Right. Being a nonprofit is a tax code. It's not a business model,
Yeah.
and all of the other things that you've said. Yes, I love that myth. I want to make sure to give a shout out to Bucks County Opportunity Council again. I know I've said your name a few times, but if you're interested in getting connected, right, if you live in the Bucks County area, please make sure to Google Bucks County Opportunity Council. If you want to email us, our email address is super simple, info@thecaap.org. We can get you connected with Erin, her team there, to make sure that you can help to really drive continued change in Bucks County. So Erin, thank you for being here. Amanda, are you going to ask me a final question, or am I off the hook today?
I'll let you be off the hook today since I think you have a few more podcast recordings with me coming up soon here that I have some very interesting questions to put you on the spot with.
Uh-oh. Okay. Well, Erin, thank you again. Is there anything else that you want to say in closing today about the organization, about community action? Any last thoughts before we wrap up this afternoon?
No, I think honestly, just I'm grateful for the community that we are in. I'm grateful for the support of our elected officials and our community partners to help. BCOC served over 57,000 people last year, and there's no way we could have done that on our own. It's all with partners. So collaboration, partnership is the most important thing.
Yeah, 100%. Well, thank you again for being here. We
Thank
appreciate
you.
you so much. Thank you for
Thank
all
you,
that you do
Erin.
for community action, for the board at CAP. And thank you for spending a little bit of time with Amanda and I this afternoon.
Thank you.
Thank you.
Thank you for being a part of this episode of the Thinking Cap. Check the show notes for resources and links to other episodes. And don't forget to subscribe and follow to be notified when new episodes are released. If you have any community action questions you'd like Beck, Amanda, or one of our local experts to answer in a future episode, please email your questions about community action to info@thecap.org. Subject line, Thinking Cap.